Thanks for connecting to this virtual poster presentation and discussion with a recent AMCP Foundation Best Poster awardee. Next slide, please. The AMCP Foundation Best Poster Competition is hosted at each AMCP national meeting. And we want to thank Artia Solutions for their generous support of the competition. Next slide, please. So I'm your moderator today, Jeff Heater, Director of Pharmacy at Blue Cross Blue Shield Nebraska, and also an AMCP Foundation Joint Research Committee member. And it's a pleasure to be with you all today. Next slide, please. So a little bit about the Joint Research Committee, or JRC for short. Our main objective is really to promote and encourage and the creation as well as the distribution of relevant and credible research and the initiatives that go along with that advance patient care services within managed care pharmacy, but also to improve healthcare for all. And we do that through 3 initiatives. The first one is to develop and update a research agenda, which really identifies and then also prioritizes critical evidentiary gaps within the managed care pharmacy spectrum, and then disseminate that research agenda to evidence generators, as well as funding bodies and others for undertaking of research initiatives that address those evidentiary gaps. And then finally, to cultivate student and practitioner interest in research. Next slide, please. So we do that and have and focus on a research agenda. And there's really 4 main pillars that make up that research agenda, and they're listed here in front of you. The first pillar is really a focus on real-world evidence that informs managed care pharmacy decision-making. The second pillar is focused on value-based models and how do those models within managed care pharmacy address the overall total cost of care. The third pillar focuses more on benefit design and or utilization management strategies and what are those impacts on patient outcomes. And then the fourth pillar, the impact of direct patient care services that are provided within managed care pharmacy and how does that influence and affect patient outcomes. Next slide, please. So with a focus on the research agenda as well as the objectives of the JRC, I'm honored and privileged to be joined today by Amy Wu, who is a recent AMCP Foundation Best Resident Fellow Poster Award recipient. Amy, take us through your research. Thank you for joining us.
Thank you, Jeff. Hi, everyone again, but my name is Amy Wu, and I'm a second-year Health Economics and Outcomes Research and Market Access Fellow at UNC in Nassau. And the topic of my research poster is a systematic literature review examining the economic burden associated with COVID-19 vaccine hesitancy. Vaccine hesitancy has been recognized as a major global health challenge. In 2019, the World Health Organization identified vaccine hesitancy as one of the top 10 threats in global health. Vaccine hesitancy is defined as the delay in acceptance or refusal of safe vaccines despite the availability of vaccination services. Now, this hesitancy can have severe consequences. Delays or refusals in vaccination contribute to a significant increase in disease burden and can put immense pressure on public health systems. And in the context of COVID-19, vaccine hesitancy really emerged as a critical issue. One study examined global vaccine hesitancy, and it revealed that the rate of hesitancy was 28.5% in June of 2020 and 24.8% in June 2021, and this spanned across 23 countries. For my research project, this systematic literature review will seek to describe the economic burden that's associated with COVID-19 vaccine hesitancy throughout the course of the pandemic. For the methods of this research project, a literature search was conducted from March of 2020 to September of 2023, and this spanned across 5 databases. Some keywords and mesh terms that we really focused on were COVID-19, vaccine hesitancy, and economic costs. We included English language abstracts and publications that reported any economic costs of COVID-19 vaccine hesitancy, and we excluded any studies that only estimated unit costs of vaccines, animal studies, or costs that we could not derive from. For the screening and extraction process, titles and abstracts were screened by 3 reviewers, and the full text was screened by 2 reviewers using Covidence, with 1 reviewer resolving the conflicts. And lastly, data was extracted using a predefined data extraction table in an Excel sheet, and it was done by 2 reviewers. Diving into the results, this review included a total of 47 articles, with 7 being economic modeling studies that forecasted vaccine hesitancy costs, and 21 studies on willingness to pay and willingness to accept. And lastly, 19 studies on lottery and guaranteed incentive schemes, which estimated the impact it had on vaccine uptake. This slide summarizes the economic modeling and cost analysis, so the impact that vaccination rates had on costs incurred by the health system. Amen 2021 found that unvaccinated adults' preventable hospitalization cost over $13 billion in just 6 months, whereas Bradshaw reported $61.3 million in avoidable ICU costs in a similar period. March 2021 showed that a 1% increase in vaccine coverage could save over $600 million in medical costs and $1.3 billion in productivity losses. These findings from these studies emphasizes the economic burden from being unvaccinated, as well as the economic benefits of increased vaccination coverage. This slide discusses the 21 willingness to pay and willingness to accept studies that we found, and this was conducted across multiple countries, with respondent numbers ranging from 301 to 4,164. Of these studies, 11 of them focused on willingness to pay, 4 of them on willingness to accept, and 6 reported on both. The mean willingness to pay for vaccination ranged from $1.60 to $259.51 across 15 studies, while 8 studies reported that 41 to 100% of participants were willingness to accept the COVID-19 vaccination at no cost. These ranges really highlight the differing economic perspectives on vaccine acceptance and willingness worldwide. Now let's take a look at the findings from the 19 studies on COVID-19 vaccine incentives. Most of these studies were conducted in the US, with 2 being in Germany, and the lottery incentives varied widely from $34,000 to $5 million, while guaranteed incentives ranged from $10 to $10,000. We noticed that statewide programs included a mix of these approaches. Lottery prizes were offered by several states, with cash incentives ranging from $302,000 to $5 million, and some states featuring multiple million-dollar prizes. Guaranteed incentives included gift cards and other prizes. For instance, Connecticut offered a free drink, and West Virginia gave U.S. Treasury bonds. These initiatives reflect the diverse strategies that can be used to encourage vaccine uptake. In conclusion, the economic burden of vaccine hesitancy is significant on a global scale, particularly in the context of COVID-19. Therefore, by addressing specific factors contributing to hesitancy, such as misinformation, we can have a profound impact on the public health outcomes. Therefore, it's crucial that investments are made in interventions that not only increase vaccination uptake, but also can target the root causes of hesitancy. By utilizing these insights, policymakers will be better positioned to anticipate future costs and plan more effective vaccination rollouts, ultimately improving both economic and public health outcomes. Thank you for listening to my presentation. My contact information and references are located on this slide, and thank you again.
Thanks, Amy. That was very interesting, especially with where we are coming out of COVID-19 and as people evaluate and as we get further away, how does that potentially influence vaccine hesitancy and stuff like that? So very fascinating and work that and research that you did. So thinking of that research and also thinking back to our research agenda and the 4 pillars, where does your research fit and why within those 4 research pillars we went through?
Yep. I think my research out of these 4 research pillars really fall under the value-based models in managed care pharmacy to address total cost of care. So the reasoning why is that vaccine hesitancy can really contribute to the total cost of care of a health system. So this can include preventable healthcare expenditures, productivity losses, and just any cost that the health system can incur. And therefore, this research, by analyzing these costs, it's important to integrate preventative measures like vaccination into these value-based care models and bring to the attention to policymakers on potential like statewide incentive programs, how willing are populations on a global scale willing to accept this COVID-19 vaccination. So this model can prioritize cost effectiveness as well as outcomes. So emphasizing how addressing vaccine hesitancy can overall reduce healthcare spending while also improving population health.
Great. And I think you've kind of started to answer my next question I had for you. And it's, you know, as you look at the research that you did and the systematic review, you know, why did you focus on this particular research topic?
Yep, that's a good question. I selected this topic because I felt like it could address kind of a gap in understanding on how behavioral factors such as vaccine hesitancy can really significantly affect the healthcare system in an economic perspective. So really the COVID-19 pandemic emphasized that there's economic impacts of low vaccination rates. So I wanted to explore deeper into this issue to hopefully inform policies aimed at reducing total healthcare costs through targeted interventions. So knowing this knowledge and moving to the future in case future pandemics come up, just having these cost-efficient strategies and preparing and managing the country and the health system with this, I think we would be better equipped to respond to a similar crisis.
Thank you. So, you know, as you kind of think through the process that you did and, you know, you selected your topic of interest, you know, and as you went through the process of doing your research, what'd you learn? Like, what was one of the either aha moments or one of the big things that you took away from this experience and the research that you did?
Yeah. As a HUR Market Access Fellow, it's really important to understand research methodology. And therefore, I gained a pretty deep understanding of systematic literature reviews. So this encompassed how to create a comprehensive search strategy, how to really critically evaluate sources, and really synthesize data across all these different study designs. So really learning how to translate all of this complex data, pulling it together into some meaningful insights that can hopefully guide healthcare providers, policymakers, and managed care organizations in addressing vaccine hesitancy and its economic impacts.
So, kind of taking that to the next step, then, and as we, you know, one of the objectives that the JRC has is also, you know, bringing along the next generation, if you will, of researchers. But we also know that there's others that, you know, maybe in the working in various roles and are interested in getting into either conducting research, getting into research for the first time. What advice would you give those individuals that are looking to really either get more involved in research, or how would they start?
Yeah, no, that's a good question that I definitely had when I went through pharmacy school and now being a fellow. So I think in pharmacy school, really reaching out to professors that you really gravitated toward, whether they taught therapeutic areas that you were interested, whether you were interested in some of the technical skills that they taught. And I personally gravitated toward my pharmacoeconomics professors that really focused on outcomes research, which led me to my position as a HOR Market Access Fellow. But having a principal investigator that can really teach you about the technical aspects and really bring you to ask really cohesive and robust research questions. And another advice I have is really having a goal in mind. So for example, a goal in mind for this was to be able to present at AMCP Nexus and eventually get a manuscript out of this and having publications into the world. So I think having a goal in mind and having a principal investigator you really trust would be my advice to future students interested in research.
Right. I think though that's great advice, and really gives a perspective into those looking to get into research. You know, things to keep in mind as they go through and have that interest. So I appreciate you sharing that with us. Amy, it's been a pleasure getting to know you and your research today. I really want to thank you for joining us and appreciate the time that you gave. And also congratulations on your Best Poster award.
Thank you, Jeff.
So I want to thank you for listening. And if you're looking for more information on the AMCP Foundation Best Poster Competition, more information on the Joint Research Committee or poster presentation resources, you can visit the AMCP Foundation website, and some of those websites are listed here on the slide in front of you. Finally, a new AMCP collaborative community is now live. The managed care research community is designed to facilitate the exchange of ideas and information and encourage in-depth discussions related to managed care pharmacy research. So join today and engage in innovative and thought-provoking research discussions. Again, I want to thank RTS Solutions for their support of the Best Poster competition and for Amy for joining us today. Thank you, everybody, and have a great day.